for a patient who had problems with the respiratory system, or the patient who had surgery and you have to expand the lungs. And this position requires the patient in sitting position or upright position. Okay, so since our patient is in the bed, we just position the patient in Pythagoras position. Okay, or maybe you can place the patient in a chair and ask your patient to sit. Okay, so how do you do the diaphragmatic breathing? So technically from the name itself, you should see a movement of the diaphragm to make sure that the lungs is properly expanding. So how do you do this one? Okay, you face your patient and use your two hands, two palms, okay? And put it here in the diaphragm area like this. And instruct your patients to breathe. So how do you know if the patient is breathing effectively? You would see that this two thumb is separating, expanding. When the patient inhales and the patient exhales, it goes back. That means the patient is effectively doing the diaphragmatic breathing, like that. Okay, ask your patient to take a deep breath, and then you will see the movement of your hand. The thumb are separating, and then the patient exhales, inhale and exhales, you will observe like this. Okay, this is diaphragmatic breathing.
And first lip.
Okay.
Combine it with the numbers.
Okay, the next one is the pursed lip breathing, especially if your patient has COPD, or chronic obstructive pulmonary disease, wherein your goal is to make sure that there's a maximum amount of carbon dioxide being expelled in breathing. Because we know already the problem with COPD. The carbon dioxide cannot be expelled effectively. So with pursed lip breathing, we ensure that the maximum amount of carbon dioxide is expelled out of the lungs. So how do you do this? Inhalation and exhalation is very important. No, just from the word itself, purse, you know purse, you have purse, especially female. Okay, lip. So that means you need to it's like to follow that. How does the purse look like this?
Like when we want to blow candles
Okay.
on a birthday, we want to blow it so that all goes off, no?
Yes.
That is what
Yes.
we
In this procedure, exhalation is longer than inhalation because we know already the purpose. We want to expel as many carbon dioxide as possible. And in your book itself, there is a counting that we follow. Okay? Normally, inhalation is 3 counts, and exhalation is 7 counts. It's like inhale. Okay. As ma'am, we're going to do pursed lip breathing. I want you to, when you exhale, I want your lips to be like a purse. Okay? And when you inhale, we will count 3 counts. But when you exhale, we will count 7 counts. Okay?
Inhaling is through the nose, exhaling
It's
is
through the mouth. Okay, ma'am, can you do it? Inhale. 1, 2, 3. Exhale. 1, 2, 3, 4, 5, 6, 7, 8. 7, sorry. Thank you, Mr.
Yeah,
7
plus 3. Go beyond 7.
Okay, and you need
So
to
they
tell
will
your
be
patient the purpose and why it is done. And the position is also the same. Polars position or high polars position. If your patient can sit, it's fine also, or upright position, but never in supine position. And the last is half cuffing. Half cuffing.
HUF. Half cuff.
Yes. This is very important, especially if your patient just had a nebulization, or if your patient has a productive cough and you want to expel it because it is obstructing the airway. So how do you do that? From the word itself, half, you need to instruct your patient to cough twice. The first coughing is just to loosen the secretion. The second coughing is to expel it out. It's like this. Sorry. No, I mean that's the proper way. 2 coughing. The first half, just to loosen the secretion. The second, sorry. The second cough, to expel it out from the respiratory system. Half cup, and then spit it out.
Usually
Okay.
we tell them to take First that
How we
deep
will
breaths.
explain this precision? Wait.
No, just put on your mask.
Yeah, ask them to do the inspiration first, inhalation first. So when they want to exhale, instead of pursed lip,
Yeah.
so and a small cough, then
Yeah.
a bigger cough.
Let them turn to the other side.
Yeah.
But what is important here is that you should not let your patient do this several times. Okay, cough.
They become tired.
They will develop fatigue.
Especially
So how many times per day is recommended?
maybe 3-4 times they can do all these exercises.
Let
3
them-
times in a day. Okay, but this is only if they have secretion.
If they
Other
don't-
breathing exercises, even post-operative patients, we ask them to do. The moment
Yeah.
they become conscious, they need to start. But these are mainly for patients and lot of these secretions are there.
I
Pneumonia,
forget there's corona.
How about the
COVID-19 patients.
Yeah, I forget that's why I remember.
he would do.
Don't worry, there's no secretion.
He's healthy. No corona.
Asymptomatic, don't worry.